It was, I remember one moment just getting out of my friend's car and I felt like just this awful pain, and I knew that it couldn't just be, you know, a pulled muscle. July 9th is when I found out that I had cancer.
It was when Maddy was diagnosed with the cancer. Her team approached us and, you know, explained to us fully about the clinical trials, what it would entail, you know, what Maddy would have to do. And honestly, it didn't really have to give it much thought. It didn't make sense not to do it. So we spoke about it with Maddy briefly, but we were all on board with it very quickly.
Like most childhood cancers, the goal of our treatment is not necessarily to prolong survival, but to cure them of the cancer, and that's certainly the case with osteosarcoma. So our goal is to allow patients who develop this cancer to live a full and normal life after they complete their treatment.
I'm very happy to be part of Dr. Bayless's clinical trial because I know it's helping many kids in the future. I'd recommend it to other people just because of the amazing outcome. Just like it should be a norm, it shouldn't be a last resort. I was a part of, you know, the trials that helped create people to not be scared anymore. Cancer can be cured, so I think I would feel very, very happy that I was part of it. From what I did, I hope that other people can just really benefit from it. I hope that my results from the trials really do make a difference.
Clinical trials like this that are done at a single institution that use a novel design in a relatively small population are generally not supported now by federal research funds, but they're very important in terms of looking at new ideas, new approaches to treating cancer that aren't necessarily on the radar screen in the large cooperative groups. And so for foundations like Gateway to completely support a trial like this, to provide support for all the resources, the personnel, the lab testing that's needed to conduct an intensive study like this is critical for us to develop new approaches and new treatments for these diseases, both in children and in adults.
The biggest reason that Clune donates to Gateway is we feel that it's in our DNA to support cancer research. Cancer has touched many of our employees, had a couple that have been affected by cancer, and some that have passed away, so it's very close to our hearts.
It's a very, very hellish journey, and one that nobody should really have to go through. So if this could be a thing of the past one day, that would be wonderful.
I got to go back to the beach, which I completely missed the year before that because the whole year it was actually 4 months during the summer. So it was 4 months on my back during the summer. So the one thing I missed was, you know, the sunshine, the beach, and I finally got to do that.
To see her now being a normal 19-year-old again is wonderful. Very, very grateful to be where we are today.
I'm living proof that it does work, and I would just say, keep doing what you're doing, and thank you so, so much.